Well, it looks like we're at 12 o'clock now, so we'll get this thing started. Welcome everyone to the American Lung Association's Community Connections presented by Novant Health and Wells Fargo. I'm your host, Carrie Beal, Health and Wellness Reporter for Spectrum News. A few housekeeping items before we begin. This webinar is being recorded and will be available after the session. Please submit questions for our panelists through the Q&A button. We will do our best to answer all the questions at the end of the session. We encourage everyone to complete the survey at the end of the session. This will help guide us as we create future sessions. November is Lung Cancer Awareness Month, a time to celebrate the many advances in lung cancer treatment and honor those living with the disease. We know that while numbers are improving, lung cancer remains the #1 cancer killer in the United States. The Journal of National Cancer Institute recently reported that US deaths from cancer continue to decline, and lung cancer has had significant improvement in 5-year survival rates, up 13% over the past 5 years to 23%. This is due to reductions in tobacco use, increases in low-dose CT scans for early detection, and funding of promising research, all part of the American Lung Association's strategic plan to defeat lung cancer. Today's discussion will focus on lung cancer prevention and screening. And now I'd like to introduce our esteemed speakers. Dr. Kumar is a board-certified thoracic surgeon who offers minimally invasive, including robotic approaches to treat benign and malignant disease processes of the lungs, mediastinum, diaphragm, esophagus, and chest wall, in addition to traditional surgical approaches. He trained at UNC hospitals in Chapel Hill for general surgery and proceeded to the University of Alabama in Birmingham for his cardiothoracic fellowship. In addition, he has completed clinical fellowships at the Mayo Clinic in Rochester and Moffitt Cancer Center in Tampa. Additionally, he was selected as an AATS Foundation Surgical Robotics Fellow. He has a particular interest in lung cancer surgical care. Kim Bea is the Tobacco Prevention and Control Program Supervisor in the Office of Policy and Prevention at Mecklenburg County Public Health in Charlotte, North Carolina. She has a Bachelor of Science degree in Public Health from UNC Chapel Hill's Gilling School of Global Public Health and has over 30 years of experience in public health education and health policy programs in community, governmental, and school settings with expertise in tobacco prevention and control with an emphasis on policy, systems, and environmental changes. In 2017, Kim became a certified tobacco treatment specialist with a national certification in tobacco treatment practice. And Mike Smith, with over 35 years of experience in the financial services industry. Mike has held a variety of positions, including compliance, broker, dealer management, and audit, including the past 25 years as a leading global financial institution based in Charlotte, North Carolina. Mike graduated from Wofford College, is a registered principal with FINRA, married with 3 children, school-aged children, and lives in Fort Mill, South Carolina. As a 5-year lung cancer survivor, Mike is active in multiple international, national, local, community, company, church, volunteer, speaking engagements, and fundraising activities. So Mike, let's start with you. You are a 5-year stage 4 lung cancer survivor. Tell us briefly about your diagnosis and why this webinar is important to you. Oh, Mike, you are still on mute.
Thanks, Carrie. I was diagnosed in September of 2016, but it was after a summer of having some difficulty breathing. And ultimately, I woke up in the middle of the night with what I thought was a heart attack because I had that proverbial symptom of an elephant standing on my chest. As it turned out, after a couple different doctor appointments, I was diagnosed with stage 4 lung cancer, but I didn't have the typical risk factors. I just had the pain and I had some difficulty breathing on a hot summer day. And so this particular webinar is important to me to get information out to everybody for awareness, not only on lung cancer screening, but listen to the signs and then be aware of the risk factors that lead to a lung cancer diagnosis.
Thank you so much, Mike. And now we'll have a question for Dr. Kumar. It seems like lung cancer can sometimes be hard to detect. What are some of the early signs of lung cancer and how is it diagnosed? Also, what are the odds of getting lung cancer if you have never smoked?
Sure. Thanks, Carrie. So the difficult thing is that early on, there may not be any signs or symptoms. However, some people can experience a worsening cough, symptoms like coughing up blood, chest discomfort or pain like Mike expressed, trouble breathing, or a history of recurrent lung infections. These are all indications that may require further investigation with the doctor. So lung cancer is most often found on imaging, like a low-dose screening CT scan for patients who qualify, or often incidentally found on imaging obtained for other reasons. Additional tests that we often use for diagnosis can include other types of imaging studies, a biopsy, or in some cases, surgery can both diagnose and treat lung cancer. And the last question about what are the odds if you've never smoked, even though smoking remains the most prevalent risk factor and most modifiable risk factor, even non-smokers who we qualify as patients who have smoked less than 100 cigarettes in their entire life, or people who've in fact never smoked can develop it. Our current estimate is that anywhere between 10 and 20% of lung cancer can occur in patients who are not smokers.
That's very interesting, and a testament to Mike who experienced that. Kim, let's talk about risk factors for lung cancer. What are the biggest risk factors for lung cancer?
Thank you, Carrie. As Dr. Kumar just alluded to, by far the #1 risk factor for lung cancer is smoking tobacco, which includes cigarettes, pipes, cigars, combustible tobacco. And tobacco smoking causes about 9 out of 10 cases of lung cancer in men and 8 out of 10 cases in women. And this risk increases with the number of cigarettes smoked per day and the number of years smoked. However, there are other causes of lung cancer. Another risk factor is exposure to secondhand smoke. Non-smokers who are exposed to secondhand smoke at home or at work increase their risk of developing lung cancer by 20 to 30%. And there are approximately 7,300 non-smokers with lung cancer every year in the US who pass away. There are other environmental risk factors. One of the biggest is exposure to radon, which can cause lung cancer. But then there is also other radiation, asbestos, metals, and air pollution, but radon is one of the most common of the environmental risk factors.
Thank you so much, Kim. Something good to know about the secondhand smoke. And like Mike, you don't need to have a smoking history to get lung cancer, but we do want to recognize that smoking is the main risk factor. Kim, what resources are available to help people quit? And that's for you, Kim.
Okay, thank you. Had to go off mute. That was quick. Resources to help people quit using tobacco. Quitline NC or 1-800-QUIT-NOW is a great service to help anyone trying to quit. Every state in the US has a quit line, and the services provided may vary between states based on funding. In North Carolina, our quit line can be accessed by phone, web, or by texting, and we will share that on a slide at the end of the webinar today. Quitline NC can provide free quit counseling, and for many eligible callers, free nicotine replacement therapy, such as the patch or the gum and lozenge, and that is mailed to you. So that is a wonderful service. And we have tailored services for special populations, such as pregnant women, those with behavioral health conditions, veterans, young adults, and others. And this is available 24 hours a day, 7 days a week at no cost. And so I really encourage you to check out quitlinenc.com. And they can also tell you about some of the additional local programs that are in your county. Thank you.
Very good information. Dr. Kumar, is there early detection available for lung cancer, and who qualifies? Also, does insurance, Medicaid, Medicare cover it? A lot of people wonder about their finances. How much is this going to cost?
Sure, yeah. So there is early detection available. It's a form of low-dose screening CT scan. And the recommendation for who qualifies has actually recently been updated to include patients who are between 50 and 80 years old, who either currently smoke or who have a 20-pack year smoking history and have quit within the last 15 years. So lung cancer screening is, for qualified individuals, is covered by insurance providers as a preventative service, including Medicare and Medicaid. And the new updated recommendations are being reviewed by insurance companies.
Thank you so much, Dr. Kumar. And Kim, this question's for you. Lung cancer is significantly higher among Black males and other diverse populations. How does the health department play a role in supporting these groups and preventing lung cancer?
Well, Mecklenburg County Public Health focuses on evidence-based strategies that reduce tobacco use overall, which will prevent lung cancer. And this includes promoting tobacco-free environments anywhere that the public goes, as well as in workplaces, places of worship, apartment communities, and more. Tobacco-free environments eliminate exposure to secondhand smoke, and they also support people who are trying to quit using tobacco. So it's very, very important. It's also important to promote access to tobacco use treatment. So we are also working to build capacity among our health and behavioral health professionals to provide access to best practice tobacco treatment or quit support. And that includes access to counseling and FDA-approved quit medications. Providing access to tobacco treatment as part of lung cancer screening is an example of integrating that tobacco treatment to make it easier for people to access when they see a health provider. We also partner with community groups to reach higher risk individuals, such as the African American community. Our Public Health Office of Community Engagement has an initiative called Village Heartbeat, which is a faith-based heart healthy initiative within Mecklenburg County, and that is for African American and Hispanic churches. And we assist the churches in implementing tobacco-free policies, and we offer the American Lung Association's Freedom from Smoking program, which is an 8-session support group and educational series to help those who are trying to quit, and also involved in youth tobacco prevention efforts.
It's good to know you're reaching out to the churches. I feel like that's the best way to really dig into some of those communities and make connections. Dr. Kumar, as a thoracic surgeon specializing in lung cancer, tell us about the newest advancements in lung cancer diagnosis, treatment, and care.
Sure, absolutely. There have been a lot of advances applicable to lung cancer care. First, just starting with diagnosis, technological advances have allowed for detection and biopsy of smaller lung nodules, translating to earlier diagnosis and goals for curative intent for treatment of these patients. From a surgical standpoint, we're even using technology to provide minimally invasive surgery to our patients. This allows us to do the surgery to remove the cancer through smaller incisions, affording our patients a faster recovery with less potential complications. From a surgical research standpoint, we continue to investigate the optimal strategy for lung cancer, meaning how much lung should we remove to provide a good surgical, oncologic, or cancer outcome and functional outcome for the lung cancer patients. And from a medical oncology and cancer standpoint, there's a lot of excitement, advancements, and research being made with targeted treatments such as immunotherapy, which is by studying the DNA of individual tumors. All of these are serving to advance our care, longevity, and survival for our lung cancer patients.
And as we've seen, the survival rates have gone up, which is good news, all thanks to treatment and screening. So, Mike, as a person living with lung cancer, what are one or two of the biggest things that you have learned since being diagnosed with lung cancer, and what else should people know about lung cancer?
Well, thanks, Carrie. I think some of the biggest items I've taken away from this is lung cancer is not a smoking disease. Lung cancer is a lung disease. And most importantly, you have to pay attention to your body. I'm one who didn't have those traditional risk factors. A pain in the chest led down the pathway to my diagnosis with lung cancer. I was a non-smoker. I never smoked, and somehow or another, I got lung cancer. So the most important takeaway from this and this informational webinar here today is pay attention to your body, advocate for yourself with your medical team, understand the risk factors associated with developing lung cancer.
Makes sense. Thank you, Mike. This has been a great dialogue. Let's open up the conversation to our viewers. Please submit your questions through the Q&A button. We will do our best to try to answer all of your questions. Let's start with Dr. Kumar from Michael and Joyce. They have questions regarding the physician's role. What is the rate of primary care physicians who routinely order CT scan lung cancer screening for their at-risk smokers? And are patients screened for current tobacco use, and are they provided with treatment or a referral?
Sure. So the number of primary cares who routinely order screening is increasing in multiple factors due to awareness, availability, and more open communication and shared decision-making with the patients about the benefits of going through low-dose screening CTs. Yes, our patients are screened for tobacco use at offices and clinics as part of their social history. Referrals and options for quitting are available throughout our offices, and as Kim mentioned, there are resources on this webinar. Patients who need further information or guidance should absolutely reach out to their doctor with questions or concerns.
Thank you so much. And Mike, as someone who is actively engaged, perhaps you can answer Beverly's question. What kind of support is there for someone who has lung cancer?
Oh, there's a lot of different support groups available, and particularly with the American Lung Association. There's a Better Breathers Club. There's also a mentoring program that recently the Lung Association partnered with Emmerman Angels Group, and they assign a partner to you to help with that, quote, onboarding experience that you get when you first learn that you have lung cancer, and helps you walk through that journey together with another lung cancer patient that's a little bit down that journey and understanding some of the things that are going on with their bodies and their overall health with a lung cancer diagnosis.
Yeah, it's great to have that support. I'm sure you can relate to those people and share maybe what works for you, what doesn't work, what helps. So thank you so much, Mike. Dr. Kumar, here's a question from Jean. What is the latest research on mortality rates for older adults with bronchiectasis developing lung cancer as opposed to dying from pneumonia?
Sure. So bronchiectasis is a chronic inflammatory airway disease often caused by recurrent lung infections, which leads to abnormal dilation of the airway or the bronchi. However, we don't know that this disease impacts or increases rates for developing lung cancer. More commonly, it results in chronic respiratory infections.
Thank you so much. And Kim, this one's for you. John wants to know about the correlation of radon gas and lung cancer. You kind of touched on this before, but can you please explain it in depth?
Okay, sure. Radon contributes to about 12% of lung cancers annually in the US and is the second leading cause of lung cancer after cigarette smoking. If you smoke and are exposed to radon, that risk is dramatic. And radon, enters your home through cracks and holes in the foundation, well water, building materials. And about 1 in 15 homes has what's considered an elevated radon level. And this has been found in every state in the US. The good news is that low-cost radon testing kits are available at most hardware stores. And so that is a way to address that if you think you may be at risk.
Okay, thank you so much. And Dr. Kumar, Rebecca asks, are surgical options for stage 3B and stage 4 lung cancer? What are the surgical options for those types of cancer diagnosis?
Sure. So unfortunately, outside of a clinical trial or study, there's usually no role for patients with advanced lung cancer other than a diagnosis or management of specific complications, which would, illustrate the need for early detection as we can help them with surgery then.
Okay, thank you so much. And I think this next question is also going to be for you, Dr. Kumar. Vicki and Barbara would like to know, what are new treatments for early stage NSCLC in clinical trials? And is there any centralized customizable source for clinical trials for EGFR mutated lung cancer?
Sure. So the current gold standard for surgery remains a lobectomy, meaning removing the lobe or the part of the lung where the cancer is. Surgical research for early stage surgery outcomes is basically an international driven method to kind of investigate the optimal strategy for lung cancer, evaluating if removing less than the entire lobe when possible and feasible is as good or better than lobectomy. In terms of clinical trials, there's a centralized source for all clinical trials available at clinicaltrials.gov. Whoever has a question should absolutely reach out to their doctor or oncologist to see if you're a candidate enrolling in those trials.
Thank you so much. And speaking of clinical trials, Mike, what was your experience finding clinical trials or finding that treatment to really help you get through the illness?
Well, as Dr. Kumar mentioned, clinicaltrials.gov, but my particular instance, I had a treatment that I was on, a targeted therapy treatment that failed, and it just so happened my oncologist came across a clinical trial that looks like I could qualify for. So I opted for that clinical trial, and I can't emphasize enough the importance of clinical trials. A lot of fundraising goals are going into new research and stuff like that, but a lot of clinical trials are underfunded, not by money, but by patients. So I'm a big proponent of participating in getting lung cancer patients participating in clinical trials. And doing so helps change the narrative of making this horrific terminal disease into a manageable, potentially chronic disease, and hopefully one day a cure.
And Mike, I just have a follow-up question for you on clinical trials. If somebody's looking at going into one, what questions should they ask their oncologist about it? And, what should they really know?
I think probably from a lung cancer patient experience is about toxicity or some of the side effects that are associated with it. And a clinical trial drug, there may be some that are known. I'll give you a great example of the ones that I've participated in. You get a very small list of some of those potential side effects. But over time, and as the clinical trial progresses in other phases and cohorts, a lot of those type of side effects continue to grow. Other patients are different. They might be under some potentially other drug or care that they have. But it's important to share whatever type of other medications you're on with or any type of medication, whether it's prescribed or not, to share with your oncology team and the team that's leading the clinical trial. But it's very important to ask all those questions up front and to be honest about taking those type of drugs. The reason that some of these clinical trial drugs don't get out of a clinical trial is some of these people don't like the side effects and they stop taking them. They need to be honest with themselves, but also with the clinical trial team if they're having side effects that are causing them to stop taking that drug.
Yeah, that makes sense. And that's something good to know, if what the side effects are, what kind of you're getting involved with. So it looks like I have a question from Joyce. She asks, what about people who have more than one sibling in their family that has developed lung cancer who did not smoke? Should they be screened as well? That's probably for you, Dr. Kumar.
Sure. So in a person, so family history does play into it. Currently, the guidelines don't recognize that, but in that specific case, assuming that all these people are non-smoker and didn't have a lot of smoking in their home, they should speak to their doctor because they may qualify for lung cancer screening.
Okay, good to know. And we do have the session open right now. Looks like we just got another question. This one didn't want to reveal his or her name, but it asks, will the American Lung Association assist me with changing legislation in my county regarding open burning policies? Oh, so this might be pollution from outside. Almost every day, dry day, there is a smoke in the air, particulate matter is elevated. So it seems like he or she is asking a little bit more about some of these outside factors in open burning policies. Kim, is that anything you can touch on?
Well, just that air pollution is a risk factor for respiratory health, and that is an issue. One thing you could do is reach out to your local fire station or reach out to environmental health of your local health department to ask for assistance and what regulations may be in place in your community to help with that.
And this is just an off question. Do you know if there are burning policies, like regulations on what people can burn or not? I don't know if that's something you can answer.
That is not my area of expertise.
Okay.
And so again, reaching out to environmental health or your local fire departments should certainly know that as well.
Okay.
I'll add as a quick side note, I live over the border in York County in South Carolina, but your local county does have some regulations on what you can and can't burn in your residential neighborhoods, but also in commercial properties as well. So that may be another research is local county ordinance and regulations.
And then possibly reporting it if it's something that you're not supposed to burn. So, okay, well, we do have a little bit of time for a few more questions. If anyone listening wants to ask anything else, we can kind of hang out here for a minute. Or if there's any of the panelists, if I think of any other questions, I'll hang out here for a minute and see if there's anything else. yeah, we'll just hang out. I know sometimes people don't come forward at first with their questions. Sometimes they're like, oh, should I write it? Do I want to ask? Do I want to ask? So trying to give you guys a little time if somebody's debating on whether to ask a question here. Yeah, still got about 5 more minutes, and it doesn't take me that long to read the rest of this. All right, well, in case we don't have any more questions, Mike, I'll just finish one last question with you. Any rounding advice you have for people who might be going through lung cancer?
I'm sorry, any grounding?
Any advice you have for people who might be going through, overall advice, I mean to say.
Well, as a 5-year lung cancer survivor, I think a lot of people refer to me as inspirational or hope. You know, when I was first onboarded with lung cancer, I was told the overall survival rate for 5 years was 19%. Currently, overall, it's 23%. But, you know, those are broken out now by stages. Stage 4 at the time of my diagnosis is only 3 to 7% survival rate over 5 years. You know, people often ask me, even doctors, why are you here? What are you doing differently? I think the most important advice I can give to any lung cancer patient, or those people who are just getting on board with that, is things are changing. We're moving and we're changing this narrative. It's a message of hope, and it's be positive, listen to your oncology team, be healthy, eat well, but also be physically active. I like to compare a lot of the stuff that some of the drug treatment that I'm on is, you know, back in the old days, when you take chemistry or biology, you have a test tube. You didn't get a reaction until you shook it up. So by all means, be active, be healthy, and be positive. Those are stalwarts that I embrace every day. In addition to my, you know, whatever your faith-based system is, and be positive towards it. Live your life.
Sure, seems like that's what you're doing. You're still very involved in numerous activities, it looks like. So,
Harry, can I add a comment to Mike? I would add, it's never too late to quit smoking. I know not all individuals with lung cancer are smokers, but if you are and you feel like, oh, well, what's the point now? That there is always hope, and there are immediate benefits to stopping smoking, even if you already have respiratory disease. And so there is help available, and it's no matter what your age or health, there's always immediate benefit to stop smoking.
Thank you so much, Kim. I have one last question. Somebody asked, can lung cancer be cured? Dr. Kumar, will put that question on you where we're at this point.
Sure, yeah. So, you know, early stage lung cancer, we are looking for cure. As you get to more advanced stage 3 and 4, the curative rates become lower and lower, and becomes more of a, like Mike alluded to, treatment with life prolonging, but it's not generally a cure. So early stage, yes, which is why we're, you know, advocating for lung cancer screening to find these cancers earlier and treat them with surgery, which can be curative. Yes.
Thank you so much. All right, well, it looks like if we don't have any other questions, that'll be about the roundup of this session. So it looks like, yep, that's about all we have time for. This has been a great conversation. I want to thank all of you for attending today's Community Connections presented by Novant Health and Wells Fargo. I hope you found it informative, and a special thanks to our panelists, Dr. Kumar, Kim Beya, and Mike Smith. Please remember to complete the survey. Your feedback is important to us. And for more information on lung cancer prevention and screening, visit any of the valuable resources shared on this screen. Check your email for a recording of this session and additional resources. Thanks again, and have a wonderful day, everyone.